It's 2 a.m. You're mid-dream. You're an NBA starter for your favorite basketball team. For me, that would be the Chicago Bulls, draining the game winner. And then your calf seizes like a car alarm. You hop out of bed, trying not to wake your spouse or terrifying the dog. And if you've gone low-carb or carnivore, you know this moment. Let's fix it with physiology, not with folklore. Here's the game plan. I'll explain why cramps pop up on low-carb and carnivore, give you a simple daily routine that prevents most of them, show you what to do in the exact moment a cramp hits, and answer the big question. Do you need electrolytes every day, or only when your body asks for them? First, the root cause. When you cut carbs, insulin drops. That's great for fat burning, but insulin also signals kidneys to retain sodium. With less insulin around, kidneys let sodium go. Water follows sodium, so blood volume dips. Early on, you also lose glycogen, the stored form of carbohydrate in liver and muscle. Glycogen binds water, so as glycogen falls, water leaves too. You pee more, you shift fluids faster, and your nerves feel those shifts. Nerves love steady electrolytes. When levels swing, they get irritable. Irritable nerves make irritable muscles. That's your 2 a.m. Charlie horse. Your body adapts. Hormones like aldosterone rise to conserve minerals, but that takes days to weeks. Most cramps show up during this adaptation lag, or whenever demand spikes. Hot weather, hard training, poor sleep, illness, a long day sweating in scrubs, or overhydrating plain water without enough salt. Some folks live in high demand zone all the time, those heavy sweaters, endurance athletes, hot climate workers, or people on certain medications, and they simply need a bit more mineral support more often. Now the sustainability question. Can carnivore work long term without a nightly drama in your calves? Absolutely. I've been carnivore for about 2 years now. I don't take electrolytes daily, and many of my patients don't either. The secret isn't powders, it's mineral literacy. Match intake to demand. Some people feel best with a small, steady routine. Others drive salting to taste and nudging electrolytes only on days their body taps the shoulder with a symptom. This isn't a toughness contest. It's listening to your physiology. How do you decide? Daily or as needed? Think in phases. Phase 1, adaptation. This is your first 2 to 4 weeks after going low carb, or any time you dramatically change training, heat exposure, or body weight. During this phase, front load support. Add about a half to 1 teaspoon of salt across the day, on top of what you naturally use on food. That's roughly an extra 1,000 to 2,000 milligrams of sodium. Don't slam it all at once. Split it with meals and water. If you're cramping, constipated, or sleep is choppy, add 200 to 400 milligrams of magnesium at night. Forms that tend to sit well include glycinate, malate, and threonate. Citrate can help if you need a gentle nudge for constipation. Maybe not before a long commute, however. Now let's talk about phase 2, the new normal. Once you're adapted, move to symptom guided. If you have no cramps, no dizziness when you stand, no nagging headaches, no flat workouts, and your urine looks like pale lemonade, keep salting to taste and skip daily powders. If any one of those flags appear, nudge electrolytes for a day or 2, then reassess. Treat the signal, not the calendar. Let's put numbers on this. For the standard American diet, we generally recommend to consume 2,300 milligrams of sodium a day, and that's based on the USDA and the AHA recommendations. 6 grams of salt or 1 teaspoon. On carnivore low-carb diet, the recommendation skyrockets. 4,000 to 7,000 milligrams of sodium a day. That's 10 to 18 grams of salt, which is 1 3/4 to 3 teaspoons a day. That includes the salt on your food, broths, and any mix you use. I know these numbers seem high if you've never heard them, but in the low-carb community, our electrolyte needs are simply different. That's why we need to be careful on hot or high sweat days. We need to pre-salt meals, and many of us carry electrolytes. So don't wait to cramp and then play catch-up. In addition, potassium matters for nerve stability, but megadosing is rarely necessary. Meat, seafood, and eggs provide meaningful potassium. Consistency beats hero dosages. And if you take ACE inhibitors, ARBs, or potassium-sparing diuretics, be cautious with potassium salt substitutes unless you and your clinician have a plan. The goal is steady intake, not a swing. Magnesium is the quiet hero. Aim for about 300 to 400 milligrams per day from food plus supplement if needed. If you get nighttime cramps, take it in the evening. If you're still loosened, reduce the dose or switch forms. If you're constipated, small amounts of citrate can help. If your gut is sensitive, glycinate or threonate are usually kinder. Food first still works on Carnivore. Salt your steaks generously to taste. Sip mineral-rich bone broth. Lean into seafood and shellfish for a broader mineral profile. Hydrate to thirst. Overhydration without salt can dilute electrolytes and make cramps more likely. On the flip side, chronic underhydration will sabotage performance and recovery. Aim for calm, consistent habits instead of extremes. Now, what do you do when a cramp ambushes you? Here's the bedside rescue kit. Pickle juice or a tablespoon of mustard. I know, not Carnivore pure, but hear me out. These can activate TRP receptors in your mouth and esophagus. That reflex can quiet the overfiring motor neurons driving the cramp, often within a minute. It's not about dumping electrolytes into the blood in 60 seconds. It's about flipping a neural switch. Keep a tiny bottle for emergencies. Pragmatism beats purity at 2 a.m. For example, a salt shot. Mix a quarter to half teaspoon of salt in a few ounces of water. Sip slowly. Follow with a bit of plain water if your mouth feels like the Sahara. Position and breathing. For a calf cramp, pull your toes towards your shin and hold 30 to 60 seconds. Don't bounce. Slow breathing lowers sympathetic tone, which helps the muscles relax. Sometimes briefly contracting the opposite muscle, the front of the shin, resets the reflex arc and breaks the spasm. Topical magnesium creams or oil. Although evidence for deep absorption is mixed, but massage, warmth, and touch help. Many people report relief. Low risk, reasonable try. Lifestyle levers lower your long-term risk. Strengthen the muscles that love to cramp. Calves, hamstrings, feet, under controlled load. Finish workouts with brief stretch holds. You're training the neuromuscular system to be stable. Sleep better. Poor sleep raises catecholamines and makes nerves jumpy. Manage stress for the same reason. Plan for heat. Pre-salt and bring electrolytes for long sessions. Don't undereat. Chronically low calories and low protein impair recovery and mineral retention. If you're new to Carnivore, retire the old habit of chugging plain water all day. Your electrolyte needs changed. Your habits should too. Safety still matters. Personalize if you have kidney or heart disease, uncontrolled hypertension, or you take diuretics, ACE inhibitors, ARBs, SSRIs, lithium, and other meds that shift electrolytes. If your cramps come with weakness, numbness, palpitations, swelling, or they're new and relentless, we should check labs. A basic metabolic panel. Magnesium, ideally RBC magnesium when available. And consider thyroid or vitamin D depending on your story. Let's land the plane with a simple 4-step routine you can start today. Step 1, salt to taste on food. Then add 1 to 2 teaspoons of extra salt spread across the day during adaptation or high sweat days. Start low, adjust to how you feel. Don't forget this extra salt is for us low-carb and carnivore folk, not everybody else. Step 2, if cramps persist, add 200 to 400 milligrams of magnesium at night for 2 weeks. Track sleep, stools, and muscle behavior. Tweak the form and dose to comfort. Step 3, keep potassium steady by eating consistent amounts of meat and seafood. No whack-a-mole megadoses unless your clinician tells you otherwise. Step 4, build your rescue kit. A tiny bottle of pickle juice or packet of mustard. A small vial of salt for a quick shot. The knowledge to stretch, breathe, and reset when it hits. Here's my verdict. Carnivore is sustainable. Cramps aren't destiny, they're data. In clinic, I see 2 winning strategies. Some people do best with a small, steady mineral routine every day. And in my home, we keep Keto Chow's salty capsules and powders. I'll have a link to Keto Chow via my link tree in the video comments. Others thrive salting to taste and responding on days their environment or training ramps up demand. I'm in that second camp most of the time. You might be in the first. Either way, when you match minerals to your metabolism and your life, the 2 a.m. alarm gets quiet, and you can get back to winning championships, at least in your dreams. So if this helped, drop a comment with your worst cramp story, but keep it family friendly. What finally fixed it? And rather your team daily electrolytes or team as needed. And if you want a deeper dive on salt, why low carb folks often need more and how to do it safely, watch the salt video I've linked right here. Sleep well, stay strong, and please, 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 don't just listen to the YouTube influencer, listen to your body.